The question is that the bill be now read a second time, and I call the member for Bennelong.
Thank you, Deputy Speaker. I rise to support these bills as they seek to implement and modernise and improve the private health insurance prosthesis list. We know that the proposed legislation would amend private health insurance legislation to better define the items for which set benefits are paid by private health insurers, so that these benefits are only payable for medical devices or human tissue products that meet specific definitions. Importantly, these bills also update the cost recovery arrangements to provide for fee-for-service and levies that are consistent with the Australian Government's charging framework, and they continue on work from the 21-22 federal budget, where $22 million over 4 years was committed to modernising and improving this measure. The government has agreed to continue with these prosthesis list reform activities on the basis that the objectives are aimed at improving value for money for privately insured Australians. And naturally, we'll proceed with these reforms through our lens. Labor recognises that both public and private sectors play a critical role in Australia's world-class health system. We are a government that's concerned that Australians are abandoning private health insurance due to increasing costs and declining value. The bill's intent is to preserve clinician and patient choice in the private health system, assist in reducing benefits paid to private health insurers, and put downward pressure on private health insurance premiums. All those are very good things. They would update cost recovery arrangements to provide fee-for-service arrangements and the imposition of a cost recovery levy on each kind of medical device and human tissue product listed in the instrument. Passage of the bills before 1 July would allow the implementation of these actions, which is also a positive outcome. But, Deputy Speaker, you may or may not know, and as the member for Macarthur mentioned, some of the biggest medical device manufacturers and their peak industry body, the Medical Technology Association of Australia, are based in my electorate of Bennelong. And as you can probably understand, they've taken a little bit of interest in this legislation and thankfully have been intimately involved in the reform process. I'd like to thank them for bringing me, a new member, up to speed on this issue in a very short time. Had you asked me on the 20th of May 2022 what the prosthesis list was, I could have hand on heart said I would have had no idea what you're talking about. But thankfully, I'm a bit more across it, Deputy Speaker. From items on the general list to category and price bundling, Deputy Speaker, I now know who and what IHACPA is, which is exciting, and I felt that I've learned a lot about this issue in a very short time. Ultimately, what I understood very quickly was that this is an area of health policy that needed reform. The list can be arbitrary, the definitions are sometimes too narrow, and it is in desperate need of modernisation, given the extreme advances in technology that we see in this sector each and every day. I look forward to being part of a government that will continue on with this reform over the next few years. And this package of legislation represents the first chance the Parliament has to consider this reform that was announced in the 21-22 budget. As we heard, this is the first step in a longer process of enacting the reforms. And I guess the main message from my local constituents, be they those who work for these companies and the company in the medtech sector themselves, is that it's important that every area of the private health sector plays their part in ensuring the cost of private health insurance comes down. Medical devices represent 1/10 of private health insurance benefits paid and 9% of premium revenue growth since financial year 2013. Growth in device benefits are driven entirely by clinician and patient demand. Private health insurance sustainability must be achieved, and it can be achieved through wide-ranging reform, of which the prosthesis list is just one of them. This list is an important regulatory tool to ensure that patients in the private hospital system have access to this life-saving medical technology. It provides clarity in the delivery of healthcare by providing healthcare providers with a list of medical devices that will be covered by health insurers for policyholders with appropriate levels of hospital coverage. And as mentioned, this reform is aimed at making private health insurance more sustainable. As we all know, the cost of living pressures are hitting family budgets. Reducing the price of health insurance and putting downward pressure on insurance is a positive thing. This is part of broader and more urgent reforms to strengthen Medicare and resolve the crisis in primary care that we saw overseen by the former government. I've had the opportunity to visit many of these companies. The member for Macarthur mentioned Edward Life Sciences. There's also Medtronic, Johnson & Johnson, Abbott, and at the risk of not naming them all, I'll stop there. There are plenty. It's great to see that they're big employers locally and that they deliver great outcomes for patients across the country. I've also had the pleasure of meeting with locals in Bennelong whose lives have fundamentally benefited from access to this same medical technology. In the first few weeks since being elected, I met Andrew from West Ryde. Andrew was diagnosed with type 1 diabetes when he was just 8 years old. Type 1 diabetes has completely dominated Andrew's daily life, particularly restricting his ability to hear, see, walk, work or drive. 4 out of the 5 members in his family have now been diagnosed with type 1. He was one of the many passionate locals in Bennelong that I met with before the election and after that received access to subsidised continuous glucose monitoring and flash glucose monitoring products, which this government was proud to subsidise from the 1st of July. His ability to access a constant glucose monitoring system has saved his life and made his life more livable. Devices on this list, which we're talking about today, and devices that seek to be added to it, are life-saving. I've visited and spoken to these companies and seen their commitments to their patients and their role in innovation, training, research, and as employers who are also committed to sustainability, equity, and diversity. And the feedback that I've received from them, and many of those who work with them, is that they're very supportive of these reforms and their objectives. They would like to see the cost of private health insurance go down. The medtech sector, like any businesses, operate at capacity when they have certainty. They want to keep delivering innovation and better outcomes for their patients. I understand the sector, through the MTAA and individually, are having ongoing discussions with the Department of Health and Aged Care about the implementation of these reforms. And although I understand a number of areas remain outstanding, I'm confident that they'll be resolved in a timely manner. It's welcome that the Minister announced that the government will ensure alternative funding mechanism for the products that will be removed from the list will be mandated. That's positive, but the industry notes the detail are still to be determined. I'm confident that they'll be resolved in a timely manner. I'd like to use my time speaking on this bill to encourage the department and the medical device sector to continue to engage in good faith and in a transparent manner as they have been. Where detail is sought from the department, I'd encourage them to provide those details as quickly as possible. And where the department requires cooperation, I'd encourage all stakeholders to reach a common ground. Because at the end of the day, there are some really, really positive elements to this bill. Let's not forget about them. This reform will deliver savings to private health insurers, and if those savings are passed on, they'll result in cost of living easing for policyholders, and that is a really, really positive thing. I'd encourage all parties to ensure that those savings are passed on. Savings to policyholders are welcome and they are good. I look forward to receiving updates from the department about the ongoing process to simplify the prosthesis list and ensure it offers a fit-for-purpose pathway to assess medical technology. I also look forward to receiving positive news that all involved can have certainty throughout this process so that they can go back to focus on innovating for better patient outcomes. I'll be one of many, I can tell you, who'll be following this process as it comes to implementation on the 1st of July.